everyone, and welcome. Today we're going to demystify a really common but pretty confusing symptom called tenesmus. You know, it's that frustrating, persistent feeling that you have to go to the bathroom all the time. We're going to break down exactly what it is step by step.
So let me just start by asking you this. Have you ever had that nagging, kind of relentless urge to go, even though you know you were just in the bathroom? Well, that feeling actually has a name, and we're about to dive deep into what it all means.
So here's our game plan for today. First, we'll define what this never-ending urge really is. Then, we'll look at the two main types, dig into the root causes, walk through how doctors figure it out, and finally, the most important part, talk about how to find some relief. Sound good? Let's get into it.
Okay, so let's get right to it. What in the world is this sensation we're talking about?
So, what it boils down to is this. Tenesmus is the feeling that you need to go even when there's actually nothing left to pass. Now, here is the absolute key thing to understand. Tenesmus is not a disease, not at all. It's more like a signal. It's your body's alarm system trying to tell you that something else is going on underneath the surface.
And you know, that urge, it rarely shows up alone. It often brings friends, like cramping, a weird sense of pressure, and a whole lot of straining for, well, pretty much nothing. It's that whole package of symptoms that makes it so uncomfortable and frustrating.
So, where is this feeling even coming from? Well, it turns out it can start in two totally different places in your body, and figuring out which one it is, that's a huge first step in getting to the bottom of it.
Okay, so we have two distinct types here. On one side, you've got rectal tenesmus. This is all about your bowels and the feeling of an incomplete bowel movement. And honestly, when most people just say tenesmus, this is usually what they're talking about. Then on the other side, there's vesical tenesmus. Same sensation, but this one is all linked to your bladder and urinary system.
So, if this feeling is just a symptom, then what's it a symptom of, right? That's the million-dollar question. Let's put on our detective hats and start digging into the potential underlying causes. The first big bucket of causes we're going to look at is inflammation and infection. It's pretty straightforward, really. When the tissues in your digestive tract or your urinary tract get irritated and swollen, they can start pressing on nerves. And those nerves send a false signal to your brain that says, hey, time to go.
Let's look at some examples. You've got things like enteritis, which is when the small intestine is inflamed, or colitis, inflammation of the colon. Proctitis is inflammation specifically in the rectum. Then, switching over to the urinary side, a super common culprit is a urinary tract infection, or UTI. And there's also something called interstitial cystitis, which can really irritate those bladder nerves and create that constant urge.
Okay, next up, physical and motility issues. This category is less about inflammation messing with nerves and more about, well, a physical blockage or a problem with how the muscles are moving things along.
I mean, think about it. Even something as common as constipation can cause stool to physically press on the nerves in your rectum, which creates that constant feeling of needing to go. Then you have motility disorders like IBS, which can throw the whole rhythm of your gut out of whack. And things like hemorrhoids or anal fissures can create so much irritation that your body gets tricked into thinking you're not done.
All right, and for our last category. Now, it is really important to say that these causes are much less common, but they are a big reason why tenesmus is a symptom you really shouldn't ignore.
In some situations, a tumor in the pelvic area, like with rectal cancer, can directly cause nerve pain and muscle spasms that mimic that feeling of being incomplete. And similarly, some cancer treatments, like radiation, can inflame the lining of the GI tract and cause tenesmus as a side effect.
Okay, I know what you might be thinking. That was a lot of potential causes, and that can feel a little overwhelming. But here is the really good news. There is a clear, established process that doctors use to pinpoint the exact root cause. So let's walk through what that journey looks like.
It's actually a really logical step-by-step process. It always starts with just talking to your doctor about your history and doing a physical exam. From there, they might move on to lab work, maybe some imaging, and if they need a closer look, they'll use more specialized tests like scopes. And what does all that actually involve? Well, the physical exam might include a digital rectal exam to feel for anything unusual. Lab tests can look for signs of infection in your urine, blood, or stool. Imaging, like X-rays or ultrasounds, can spot things like inflammation. And scopes, like a colonoscopy, give the doctor a direct video feed from inside your colon. It's all about gathering clues to solve the mystery.
And now, for the part we've all been waiting for, the path forward. Once you have a diagnosis, how do you actually find relief? This section is all about the solutions.
This brings us to probably the single most important principle of treatment. You don't actually treat the tenesmus. You treat the condition that's causing it. All relief comes from addressing that specific underlying root cause.
So you can see how this works, right? The treatments are tailored perfectly to the diagnosis. If it's constipation, the solution could be as simple as adding more fiber to your diet. If it's an infection, you need antibiotics. For something like inflammatory bowel disease, a doctor might prescribe anti-inflammatory drugs. The treatment always follows the diagnosis.
But, it's not all about what happens in the doctor's office. There are some really powerful things you can do in your daily life to help manage symptoms and support your overall health. This is where you get to take back some of the control.
An anti-inflammatory diet can sound kind of complicated, but it's really not. It's all about focusing on whole, natural foods, things like lean proteins, tons of fruits and vegetables, and healthy fats. And at the same time, you're just trying to limit the stuff that can cause inflammation, like highly processed foods and lots of refined sugar.
And there are other great strategies too. Just staying hydrated and active is huge for your gut and bladder health. Keeping a little journal can help you figure out your personal triggers. Stress management is a big one. It can reduce muscle tension. And of course, practicing good hygiene can help prevent UTIs, which, as we know, are a major cause of that bladder-related tenesmus.
So we're going to leave you with this question. Understanding your body is the first, most powerful step. The next one is taking action. It doesn't have to be massive. Maybe it's just drinking an extra glass of water, or trying one new whole food, or maybe it's just making that call to talk to a doctor. So think about it. What's one small step you can take for your health today?